Good morning, Dr. Sooley, Sooley Chiropractic Health Center. Wanted to demonstrate to you today the importance of upper cervical chiropractic for spinal health. So what I have here is a approximately 15-pound bowling ball on a broomstick. This represents your head and your spine. Now watch what happens when I try to bring this up onto the desk and hold this broomstick. You see how it sways side to side? And it's difficult for me to hold that up because, of course, the weight of the bowling ball is a lot more than the dimensions of the broomstick. This represents your spine, which is a central support structure of your body, and your head that sits on top, which weighs in the same neighborhood, 10 to 15 pounds on average. Do you get it? Do you understand how a balance here at the base of the skull, that first bone in your neck area, has an impact on the rest of your spine? You cannot separate the two. For that reason, balancing your upper neck area on your head is our major objective, and something that should be understood to impact the entire spinal health. From the very top all the way down the spine is impacted by the weight of your head. We want to be level and even, starting at the top bone in your neck area. Hope that helps. All right, well, we're sitting here with Pastor Adam today. We were chatting a little bit about his history, and he's agreed to share. So Pastor Adam, tell me about what sort of problems you were having in your body prior to you starting into the chiropractic care.
All right, well, one problem that I was keenly aware of was my feet. But the other problem I wasn't as aware of until I got adjusted, and that was being able to sleep through the night and not have to go get up to urinate. And so my feet took a little bit longer, but the insoles, the stretching, I was able to visit people, not just preach but pastor. And then with my there must have been a pinched nerve or something that went to my bladder, so I could sleep through the night after the first adjustment, which was huge, thank you, huge help. And there's been other things as well, just, in terms of my attitude being more pain-free. But the feet, the stretching, all the benefits, just learning, the knowledge of learning, seeing the x-rays, it's been great, and having you as a friend, as a fellow Christian, we're on the same page philosophically as well. It's just nice, comforting.
Thank you. Appreciate you sharing with us today.
You're welcome.
Okay, we're in the office today with one of our patients, Megan. And Megan, what is the condition that brought you to Dr. Sooley's office?
I have neck degeneration, come to find out.
Okay.
And I had some numbness down my arm.
Okay.
I kept dropping things. I couldn't even button my baby's snaps. It was just getting so hard to do your daily mom activities.
Yes.
Pushing strollers, I just couldn't even feel it. It was just so numb. So that's why I came in.
Okay. And what did you try in the past that didn't work?
I had gone to some physical therapy, and they were just mainly working on my shoulder, getting it strengthened, and it seemed to give some temporarily short relief, like that day.
Mm-hmm.
But I had to come in all the time to get the massages and the ultrasound type therapy.
Okay. And what have you experienced since you've been coming to our office to see Dr.
Well,
Sooley?
really more permanent relief.
Okay.
I don't have numbness at all when I'm pushing. I don't drop things anymore. And really, I just come, I think, to maintain that, because I think I need it to avoid it anymore, because it's just gone. So.
Okay. Well, thank you so much.
Okay, you're welcome.
Greg, tell us about your journey with chiropractic here. Before you even came into the clinic, tell me about what you were experiencing and how that was affecting you on your daily activities.
I'd get up in the morning and I was in some very severe pain with my neck and my shoulders, and it would go all the way down to my hips and my knees.
Mm.
And I thought, I'm only in my mid-50s. What's it going to be like a few years from now?
Mm.
And I noticed changes in my mood, in my daily activities at home, that I just wasn't doing the things that I like to do. And I thought I was living on over-the-counter pain medication, and that wasn't getting me anywhere. And I thought, I'm going back to the chiropractor on a regular basis.
And once you started getting chiropractic care regularly, tell me about the changes that you noticed as far as your daily activities, your work, and sort of thing.
One thing that I noticed was my balance improved greatly. My mood improved for the better.
Mm-hmm.
I was able to get up out of bed in the morning with no pain. My nights of sleep became more solid in my sleep, instead of tossing and turning, rolling around trying to get comfortable all night long. And I used to suffer with restless leg syndrome, and that has disappeared.
Mm-hmm.
And that a lot of that kept me up during the night too.
Absolutely, understood. And as you went through your chiropractic care, you went back to your doctor and had a physical exam and some blood work. And tell us about that. We reviewed it, but tell us about some of the changes that you noticed with that.
Every 6 months, my doctor likes for me to get blood work done, so she can check my triglycerides, cholesterol, my blood sugar levels, and they were all in the normal range of where she would like for them to be at.
Awesome.
And my blood pressure is better than my doctor's.
Well, that's fantastic. Good changes with regular chiropractic care. So thank you for sharing with us. Appreciate it.
Thank you, Dr. Sooley.